Welcome to Madrid.
Welcome to the Improved PD Academy.
I welcome you for the first Academy of the Improved PD project. We have developed a 3.5 days program. I think a very complete program in which you will have a good point of view from both the clinical research and from the basic research about the peritoneal dialysis.
Chronic kidney disease in terms of quantity you can define by this classification, but in terms of intensity, and intensity of progression is defined by albuminuria. The more albuminuria you have in your urine, the more albumin you have in your urine, the more problematic is your disease.
The first evidence that the T cells are altered in patients in PD treatment on hemodialysis were from the 19th, and since then there has been a lot of studies showing that chronic inflammation is a characteristic of these patients, and there is an alteration not only in T cells, also in macrophages, in complement activations, and many things.
Large samples are more precise than small samples. We all, I think, know that. But it's quite surprising how small samples yield extreme results more often than large samples do. And I just wanted you to bear that in mind. I mean, some of the experimental data I'll show you has small numbers, but in your own experiments as well, as you're starting out in your PhDs, this is a really important concept, okay? And that's the reason why the US states that have the highest and lowest incidence of kidney cancer have similar characteristics. It's because they have small populations.